Hello, I'm Eric Singer. This is Argonne's Public Affairs, Science, and Technology Past Fusion Cell Flash Briefing. How do you talk about sensitive subjects online to your community, like STDs, sexually transmitted diseases? Joining me with answers is the Pueblo Department of Public Health and Environment's Public Information Officer, Sarah Joseph.
The health department in Pueblo is always looking for ways that we can reach our target audience. And sometimes that might be somewhat of a shock for what they're looking at, or humor. And for October, we look to combine both of them while we educate and raise awareness about sexually transmitted diseases. And our theme of all October is STDs are scary.
What is someone going to see on your Facebook and other social media accounts about STDs?
For our STDs Are Scary campaign, we designed images that identified an STD and gave educational information and encouraged people to get tested for the STDs. And we are posting one image a week on multiple platforms. So that is Facebook, Twitter, and Instagram. And within that, we're raising awareness and encouraging people to get tested, because the scary part is most people don't even know they have STDs unless they get tested.
When you put this one image per week, how do you choose that image?
The image is made by the content and information of our subject matter experts. They know the information that people are needing when they're diagnosed with these sexually transmitted diseases, or they could use to prevent getting these sexually transmitted diseases. So we get the images and the content, and then we have a general theme for the graphics with ghosts and goblins that make it scary and tie into the month of October with Halloween.
So this will be unveiled at for Halloween. How did you convince management to tackle a subject like this?
When we were designing this campaign to reach out to the community to educate and raise awareness about sexually transmitted diseases, we were very fortunate to have the clinic manager in the room with us, with a subject matter expert, to meet with our clients day to day. And the subject matter expert said, let's do a scary Halloween campaign to let everybody know that STDs really can be scary, and we have to test to know if you have it and if you need to be treated. And at that point, the program manager bought in and let his division director know, and all other management throughout the building.
How will you decide if your campaign is successful or not?
This is the second year of using the campaign, and it went well enough last year to use it again this year. And at the end of October, we will then look at our insights and analytics and compare October of 2018 to October of 2019. And we will also look at those posts for other clinic and STD posts we do throughout the year and see what the community is engaging on in the social media.
What advice would you give other information officers about doing something like this, potentially controversial, and convincing management that this is a good idea?
It's important for everybody to know the audience they're trying to reach, as well as the best way that the audience will receive the information. And at that point, you can design campaigns and propose them to your management, letting them know that a standard black and white government education still photo isn't always going to work. Sometimes you need to change up what you're showing to grab the attention of your viewer, which will in turn get your message across.
Anything you'd like to add?
We know at the Pueblo Department of Public Health and Environment, it can be scary to learn you have a sexually transmitted disease. And in this campaign, STDs are scary, we're trying to educate and raise awareness. And we were fortunate to learn our audience, how to get the information to them, and gain approval by our directors in our organization to communicate through the STDs Are Scary campaign. We'll be able to look at the analytics and see how the campaign compares to last year when we did it, as well as to other sexually transmitted disease information we run throughout the year. And from that, we'll be able to improve it to continue to run our messages next October.
If you'd like to hear previous Alexa Flash briefings that include best practices and tools to help your organization, like the Argonne Past Fusion Cell Facebook page, or connect on Twitter and Instagram at Past Fusion Cell. You can also check out the Past Fusion Cell's online toolkit for useful templates and information. Go to pastfusion.gss.anl.gov.